This is Dr. Indranil Dey, and today we will be talking about a very important topic. Presently, I am attached with Zenith Super Specialty Hospital and also with CMRI Hospital, Calcutta. So, the topic of discussion today is a very important topic, especially as far as the female population is concerned. That we will be talking about gastroesophageal reflux diseases and its association with especially post-menopausal women. Women after the age of 45 or around 50 years of age who are almost on the verge of completing their menstrual cycle period. So as first of all, a brief introduction about what is the menopause. Menopause is the period of time during which the menstrual cycle of a woman comes to an end or is about to end in a few years. Perimenopausal, or once it finishes off, it calls as menopause. So as we all know that menopause causes a huge changes in different changes inside inside a female body, and these are not only the changes which are associated with the menstrual cycle, but also because of the changes in the different levels of hormones, there are different types of changes and different kind of health issues that can arise, especially in a menopausal woman. So which includes like cardiac problems, problems with the bones, osteoporosis, and even sometimes our topic for today, that is the gastroesophageal reflux disease as well. So what is this GERD or gastroesophageal reflux disease? First, we have to understand that in case of a normal digestive system, what happens that we take the food by the mouth, it goes to the esophagus, it goes into the stomach, and down to the part of the intestine, digestion, and ultimately the waste products are being thrown out of the body as feces. But in case of gastroesophageal reflux disease, what happens is that because of some problems between the esophagus and the stomach, some of the material from the stomach, instead of going down into the intestine, what it does is that it moves up towards the esophagus. And as we all know, most of us are mostly aware that stomach has acidic content. So when this acidic content, along with some undigested food particles, goes up the ladder instead of going down to the intestine, what it happens is that it causes a burning or an unusual sensation in the lower part of the esophagus, which is basically the middle part of the chest, where we feel some kind of a burning sensation. And that burning sensation, along with a feeling of bloating, uneasiness, and even sometimes pain in the middle of the chest, in this epigastric region, in the middle of the chest, as you can see. So that is called as GERD or gastroesophageal reflux disease. Although gastroesophageal reflux disease is mainly associated with the male population, but postmenopausal women can also suffer from this kind of reflux diseases and can feel this kind of epigastric pain, discomfort, and even the feeling of acid or an unusual sensation in the mouth as well. The main reason is hormones. As I have already mentioned, that postmenopausal or menopausal women undergoes a entire change in their hormonal composition because of the finishing of the menstrual cycle. So during the time when the menopause arrives, what happens? The critical is that the serum estrogen level, that is the main vital hormones for maintaining the menstrual cycle, comes down. And at the same time, there is a difference in the alteration of the balance between the different types of male hormones, female and male hormones. So what happens is that during the time of menopause, the estrogen level goes down, and at the same time, the testosterone level goes up. And at the same time, it increases the chances of GERD. Less estrogen results in allowing the food to stay in the stomach for a longer period of time. And at the same time, what it does is that it weakens the esophageal sphincter. Now, what is a sphincter? Now, sphincter is kind of a valve which opens and closes between the esophagus and the stomach. So the valve, what it does is that it allows the food from the esophagus to go to the stomach. And once the food reaches the stomach, the valve closes. But in because of these hormonal imbalances, what it happens is that the valve doesn't function properly. That means it doesn't shut down properly once the entire food goes into the stomach. So as a result of which, once the food reaches the stomach, instead of going down to the intestine, what it happens is that sometimes it push opens the valves and goes in a reverse direction towards the esophagus, causing this burning sensation. And we can feel that there is some kind of acidic senses in our mouth, and as well as some pain in the epigastric region as well. And at the same time, what happens is that because of the lowering level of estrogen, it increases the serum cortisol or the stress hormone. So because of this increase in the level of cortisol, what it does is that it increases the hunger, appetite, and at the same time, sometimes it can result in some weight gain. And this weight gain doesn't only the physical weight gain, but also there can be fat accumulation around the stomach, which is also known as the visceral fat, which in turn can also worsen the symptoms of GERD. But the good thing is that GERD or gastroesophageal reflux disease can easily be controlled with some lifestyle modifications, changes in our day to day life, changes in our food habits, and especially by keeping our cortisol levels down. So, how to do that? So, first of all, we should start from exercise. The most important criteria for to keep ourselves healthy is to start with an exercise. 10, 30 to 40 minutes of brisk walking, aerobic exercises a day is very important for keeping our weight under control. Second, getting ample amount of sleep, because sleep helps in release of serotonin and other happy hormones, which reduces down the stress hormones, that is the cortisol, and enables you to react to this effect of the cortisol, that is of excessive appetite and weight gain. So sleep. Third foremost, that is important, is diet. That we shouldn't have a very rich fatty diet, especially full of spices. Not only that, we must decrease the use of oil in our diet. Must preferably use olive oils or others or omega-3 fatty acids. And at the same time, what we should also do is that we should not have drinks like alcohol, carbonated drinks, or all sort of drinks which are fizzy drinks which are available in the market. And at the same time, we must not smoke, because smoking also increases the risk of gastroesophageal reflux disease as well. Apart from that, our lifestyle modifications, we have said about the exercise, but also what we should do is that in our diet schedule, that most of the time we don't have time to have enough amount enough amount of meals. We usually take one in the morning, one in the afternoon, and one at night. But instead of that, what we are suggesting is that instead of taking three large meals, break that meal into six small amount of meals every 2 hours or 3 hours. Small amount of meal can improve the gastric clearance, means it gives your stomach or the gut enough time so that it can be cleared out from the stomach to the intestine and doesn't overflow. And also, by doing this, what we can do is that we reduce the pressure on the stomach, and thereby reducing the symptoms of gastroesophageal reflux diseases. And at the same time, what we can do is that apart from these small type of meals that we should take in regular intervals, what we can do is that we can also not to take pain medications or painkillers out of random, like for example NSI, because what it does is that it worsens the gastric covering layer of the stomach and thereby increases the risk of gastritis. Sometimes chronic users can cause peptic ulcers and also worsens the symptoms of gut as well. And it is very important to maintain a healthy body weight, because an overweight person has an increased chance of developing gastroesophageal reflux disease rather than a person who is lean. And why we concentrated on no smoking? Because smoking increases the risk of GERD associated esophageal carcinoma as well, cancer of the esophagus as well. But anyways, if this lifestyle modifications doesn't help you and doesn't allow you to improve your symptoms, so definitely you must visit a nearby doctor or a physician or a gastroenterologist and take the necessary medications or the necessary advices or undergo some necessary procedures or investigations in order to find out the cause of it. So, first, last and foremost, what is important is that, first of all, it is very important to understand the symptoms of gastroesophageal reflux disease, to take appropriate measures to keep it under control, and last but not the least, if at all the lifestyle modifications and the uh, other ways which I have said to control this is other ways which I have mentioned to control the symptoms of GERD is not working, to go to a doctor undergo the relevant investigations, take the required medications, and keep it under control. So that's it for today. Thank you, everyone.